Hey guys, Texas Slim here. Today we're going to have a podcast. We're shaking it up here a little bit. Finally, we're getting a little bit more organized. I am getting more organized. We're going to have Andy with CrowdHealth. We've partnered up with CrowdHealth, the Beef Initiative has, and we did a podcast this week, and I want you guys to check it out. You know, we're both on a mission to save a lot of lives. Me personally, I have a goal this year is we're going to save 100,000 people's lives. We're trying to get 100,000 people on our Substack. That's the gateway into this new international lifestyle. It's value for value. It's more than just about beef boxes. This is about saving children's lives. It starts with us, the adults, the parents, and it's time for us to basically point our compass, in a different direction. This week with me, I'm pointing my compass back down to South Texas, but I'm going to go via Lubbock, Texas, where holy cow, Ann and Weldon Warren are out there. I'm going to go spend a couple of days out there on their ranch. We're going to talk business. We're going to talk strategy. We're going to talk the Great American Rancher. We're going to talk about the Great American Health Initiative that we're kicking off on November 5th down there at the, that new processing plant that we've been working on. Well, Cole's been working his butt off down there, and I don't think he slept in the last, 6 weeks now, but they're up and running. For everybody that has placed orders, thank you so much for your patience. This is a one-time thing. This ain't going to be any more delays after this. We're about to feed a nation, and we're very confident about that. So thank you for your patience and your gratitude and your respect. From there, I'm going to go down to the processing center, and then I'm going to fly out to Charlotte, North Carolina on the 21st, and they're going to have a Halloween, a Bitcoin community there. Liz and Jacob, they've put together a pretty fun function. It's going to be 2 days there in Charlotte, North Carolina. So look it up. You can always find everything through my Substack, of course, and I'm going to keep on harping on that. We're going to get 100,000 subscriptions, and we need you. We need you sharing all that. So enjoy this rip, and then you'll see me on the flip side, and I appreciate you guys. Much love, much respect, gratitude. Let's take control of this. Have fun. Hey, you don't have to pay bad insurance anymore. Let's look at CrowdHealth and see what you can get out of them. Hey, Texas Slim here. I got Andy with CrowdHealth. How you doing today, Andy?
I'm doing well, man. Thanks for having me on.
Well, it's been how long has it been since we sit down there in Austin and we kind of had a discussion and say, hey, let's partner up?
Yeah, I mean, it felt like yesterday. Maybe I don't think it's more than a month ago, was it?
I don't know, man. I've been on the road. I was trying to think the other day. I woke up and I was like, holy crap, man, I'm exhausted. I didn't know I was.
What city am I in?
Exactly. I've been to, I do this thing, and sometimes I'm good at it. I take all the damn motel and hotel keys, and the stack is getting very thick. Jeez. And it's like, I can't remember. I'm asking my family. It's like, hey, where was I on this date? So, because I've been gone so much, but it was in Austin. It was before Georgia. And I said, hey, I'm heading out to Georgia. You guys were actually a sponsor. I really do appreciate that. We got to get you kind of introduced, as far as us partnering up. And I think it's very vital within the Beef Initiative that we provide kind of a lifestyle. I always say this is the international lifestyle. People don't understand yet. And what it starts with, of course, pure nutrition, with pure animal protein, best beef in Texas, by the way. But on that note, we really need to start having the conversation about health care, and the lack of options, where we've come from, where we are now, and where we're going. And so whenever you and I sat down, we could have talked for hours, but we said, hey, let's do a podcast whenever I get back from Georgia. And so here we are. So why don't you give an introduction of who you are,
Sure.
Where you came from, what you're putting together, what you have put together. And then we'll kind of go into some discussions on and the importance of it, roadmaps, call to actions.
Sure. Yeah. No. Again, thanks for having me on. I appreciate it. I'm originally from the Midwest kid, so did not grow up in Texas, but I'm trying to. I moved here in 2014. My two girls were born here, so they are like legitimate Texans. I don't know. But you're the person to ask, like, how long do you have to live in Texas before you can call yourself a Texan?
People are asking me that a lot. One thing I guess is the Texas Slim criteria is going to be something like this: is like whenever you wear out your first pair of boots,
There you go.
and you
Okay.
can have proof of work that you've done that, and it wasn't on concrete. Then I think you might be a little bit Texan.
Okay. I love it. Well, I moved to Texas, back in 2014. I just sold a healthcare company, and we were doing remote patient monitoring. So we were monitoring blood sugars and blood glucose and weight and pulse and all that kind of stuff out of the home for folks with chronic conditions. Ultimately what we will probably talk about today is like, how do you keep yourself from having chronic conditions and getting yourself to that place? So we are in a very reactive mode to that. But moved down here and I didn't have health insurance. And so I thought that the only place to go was the healthcare.gov. And I learned quickly that those plans are pretty much garbage. My little one, who's one at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doc, who's told us she had a hole in her ear. So we had to go to the hospital, get that fixed, get the bill. It was $8,000. And I'm like, wow, holy crap, $8,000 for 15 minutes. Like, that's ridiculous. But that's what health insurance is supposed to be for. So my health insurance plan sent me something in snail mail a few weeks after that and said it was medically unnecessary, so they weren't going to pay the bill. And I was just like, man, my ear, nose, and throat doc said she was going to lose her hearing if we didn't have this procedure. Yet my health insurance plan says it's medically unnecessary, which doesn't make any damn sense, right?
Right.
So I had to stroke an $8,000 check to the local hospital, and I was pissed. So I told my plan that I'm out. If you're not going to pay my bills, I'm not paying your bills. And so we've been uninsured for the last 2.5 years, and have never felt so free when it comes to our healthcare.
Right.
Over that period of time, we've started building these tools to allow people to get really great healthcare without health insurance, and actually better healthcare from my perspective than if you're going through a health insurance. And so we've been running that for the last, almost 2 years now, and have thousands of people that have signed up with us. And we're able to get and enable people to get healthcare for about 50% of what they would pay on, healthcare.gov or some of these other platforms. So it's been a ton of fun. In terms of our conversation, I thought it was, when I was thinking about starting a company, clearly you say, okay, what is the problem, right? And we have two major problems in healthcare. One is just price. We pay twice as much for the same procedure than anyone else on the planet. But the other problem that we have is obesity. And we have twice as many obese people than anybody else on the planet. So we've gone from 15% in 1970 to almost 40% here in present day. So we've more than tripled, almost tripled the number of obese people that we have in this country. And the problem with that is that they use twice as much healthcare as folks as non-obese, right? And so we have a problem.
Yeah, it's a major epidemic, and it's the shadow in which a lot of people live in, and it's the white elephant in the room. Whatever you want to call it, it is real. It has happened, and like you brought up some numbers as far as dates, from the low 1970s, of course. And as Bitcoiners, a lot of people understand what happened in 1971. We debased our dollar. Well, we debased our nutritional delivery to our families, to our food, to ourselves, to our children. And throughout that time, this 50-year period, you can look at the statistics, you can look at the percentages, and, you say 40% of Americans, that's almost half of Americans are now obese. Mm-hmm. Okay. Well, there's another 28% that are right there on the doorstep, and they're not doing anything. They're not really getting the education or the information to change their consumption models. And that would be from the food to the audio, to the video, to education, to the information that's really readily available in the centralized world. It's not there. Yeah. And, that's what we have. We have this hamster wheel of people trying to maybe be intentional about losing, the weight or changing their lifestyle. changing the consumption models and they don't know where to turn. And, you experience it, not, you weren't obese, but what you were experiencing was a lack of true healthcare. Somebody that was going to be able to be, something, a pillar of strength that you can lean on. What I remember in the 90s in Austin, Texas, during the startup days, and, everybody was, there was good money out there for my lifetime, for me being a young professional. We never had to pay. That was part of the job. And it was amazing. I really did have great healthcare in the 90s. I never even had to use it though, because I was young and I was vibrant and all that kind of stuff. But I remember I wasn't ever stressed about it. It was something that I felt was a pillar of strength. It's like, okay, they got my back. I'm good. But during the 90s, the 2000s and then the 10s, and then now we're in the 20s, we are in a point in time. I don't have healthcare. I haven't had healthcare since I don't even remember when. And I've got a story behind that that's just fascinating as anybody else's. I'm not special, but dang, I think a lot of individuals out there are stuck in this position. And, going back to obesity, people do not realize the amount of healthcare costs that is being sucked up by obesity, the metabolical destruction that we're facing in the United States right now.
Yeah, absolutely. And, we are twice as obese, or twice the number of obese people in our country than other economically developed countries. And so, that is having probably about $1 trillion worth of healthcare costs. We spend $4 trillion in this country. About $1 trillion, I think, is directly related to obesity. And you can actually kind of do the math to figure that out. And the interesting thing is, in our country, the folks who are non-obese actually utilize less healthcare than the rest of the economically developed world. So we have an overweight of the overweight who pay, who use twice as much healthcare and pay twice as much as people in the rest of the world. And that's one of our major problems, is we just have people who are still looking at this, stupid food triangle, who think that, pasta and Cheerios are more nutritious for you than a steak. You've got the folks who are on this, rant about climate change, being anti, beef farts, right? And so that we shouldn't have, really good, nutritious food because the cattle fart and that's bad for the environment. And it's like this never ending, like, psyop on, beef being bad. Cholesterol, high cholesterol, don't eat beef because that's high cholesterol. High cholesterol will lead you to heart attacks. Like all of these just myths that get roped into our just cultural lexicon that are really, I think, having an impact on me and you, who are paying taxes to pay for everybody's healthcare, that are having these chronic conditions. And if they would just change their diet, the vast majority of these chronic conditions would go away. The latest study I saw was somewhere between 70 and 80% of chronic conditions go away if you're not obese, you don't smoke, and you work out on occasion, right? Like that's all you have to do. Like just eat better, right? Don't eat all these carbs, work out 2 or 3 times a week, and don't smoke, right? And so those are the 3 things that are going to lead you to have chronic conditions. And it's like, for me, it's my incentive is like, I want to see my kids and my grandkids and be able to run around in the backyard with them, right? Not getting stuck inside with, COPD with an oxygen mask stuck to my face, or congestive heart failure where I can't even walk and get off the couch. Like, why is that not enough of an incentive for people to be like, I've got to change my behavior. I got to change my diet. And unfortunately, we have a kind of a high time preference society where it's like, gratiate myself now, even though, in a decade or 2 decades, my body is going to be absolutely torn up. And so I'm not going to be able to do the things that, people in their 60s, 70s, 80s should be doing.
And people think that it's not achievable. People, they come to, I was having a discussion with my father. He was a counselor for addiction, LCDC counselor for over 25 years. And I use him a lot, as far as, his perspectives. But if people think, they look at food, even 10 years ago, food was different. Now, whenever people have this consumption model, this highly processed food industry, kind of what you refer to as pastas or Cheerios or whatever, those packaging things that say, heart healthy, low cholesterol, that's where the deception is. And, we talk about, we were there. We were in our 80s. My father's 81 years old. I'm smart as a whip, and he loves to be able to reflect back as well. This is something new. This is a new phenomenon that people need to accept that this is happening. A lot of times, people don't know how to change your consumption models. Mm-hmm. They don't know how to get off of this drug that now is food. Food is a drug, and it is medicinal. So how do you look at it? You get to the source of the seed of how we got here. Pure animal protein is how all of our ancestors got here, got us here to where we can, lead the charge, like you being in healthcare, and trying to, turn it on its head. And that's what needs to happen. But it starts with the individual. Sure. And you're giving great options, and one thing that's very important is that we need to kind of reiterate the importance of removing yourself from the insurance industry. That we currently are faced with. And people are very scared of that because where does that lead? Well, I'm not going to be protected. I could die. What am I going to do? Well, now there's more options and people like you, CrowdHealth, and they're starting to kind of, start to sprout up. But one thing about you guys, you guys are really stating the case. You have a very good narrative of why do you need to remove yourself right now from the healthcare industry.
Well, it's interesting, right? Because this fear emotion that people use, we're seeing in, Bitcoin, right? Mm-hmm. Because the fiat world looks at Bitcoin and says, "Oh, this is not real. It's fake. Like you can't use it for anything." The Peter Schiffs of the world who say it's gold, 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 right? And say, so they're using fear to downplay Bitcoin, right? In the food space, they are using fear to downplay animal proteins, right? Whether it be the climate, right. we're blowing up our climate, or it's high cholesterol leads to heart attacks, right? And so, I saw a stat the other day, and I'll tell you kind of a quick personal story, but I saw a stat the other day that 77% of people who had heart attacks did not have high cholesterol. And so, you can come out of that with two possible conclusions. And I thought this was interesting. One is, okay, well, maybe the conclusion is that high cholesterol does not impact heart attacks, the probability of heart attack. Or the second conclusion, and this is the conclusion that the author, who's a mainstream media, doc, right, said is, oh, well, we need to lower the threshold for what is a, bad cholesterol, right? So instead of like 100 of LDL, we want to put it to 70. And so what does that do? That gets a whole hell of a lot more people on statins and pharma and all this kind of stuff, right? And so I'm actually going through this right now because I'm a heavy animal protein eater, almost exclusively. And so I got my lab test, and my LDL was pretty damn high. It was 200, I think, and it's supposed to be 100. And so I called my primary care doc, and they're like, "Oh my gosh, you have to stop eating animal proteins. You got to just go on a veggie diet, and you have to take statins, right?" And so as you starting to do this research, like there's very clear, scientific evidence that may not be the case. Like high cholesterol may not lead to heart attacks, right? But that's the fear that they have. By the way, I'm not a nutritionist. I'm not giving health advice. I'm just saying this is what I'm going through right now. But it's the fear that's knocking down people's desire to have a high animal protein diet. And the same thing, the health insurance companies have, mind zapped us to think that you have to have health insurance. There's no other way to pay for your healthcare other than having health insurance. And I can tell you, as someone who's been doing it for 2.5 years, you've been doing it sounds like for a lot longer than that. No, you can actually, operate without having health insurance. And it's actually better for you. You're getting better care. And so, for me, I'm paying $175 a month for me. It'd be $300, $400, $500 if you were to go to healthcare.gov. Plus, on top of that, you have a $4,000 deductible. So if you just do the math there, you're paying somewhere between $8,000 and $10,000 a year as a healthy person before the health insurance plan will pay $1, right? Yeah. So I look at that and I was like, that doesn't make any damn sense. Like, I'm healthy. The probability of something really, really bad happening to me is about 1 in 200, right? I have a 1 in 200 shot of something really bad. And so I'm paying $10,000 for a 1 in 200 shot of something bad happening to me. No, I'm not going to do that. And if something bad does happen to me, I've actually got a community of people in CrowdHealth who are willing to help me out with those bills. So, and by the way, that community is full of a bunch of people. They're in their mid 30s on average. Their BMI is 4 to 5 points below the national average. They are, our people. Most of them are Bitcoiners or libertarian leaning folks that are saying the same thing as I'm saying, which is a middle finger to health insurance. Like, you shouldn't be sovereign. I should be self-sovereign, a sovereign individual over my own health. You should not have, agency over me. And so that's what we're really doing here at CrowdHealth, is saying, screw you, health insurance plans. We can take care of our own health.
And that's what a lot of people want to do. They want to stand by something. They want to say, hey, okay, I'm ready to put my foot down and let's go. Let's do that. By saying that, let's because everybody right now probably listening has never heard of this. Let's talk about how CrowdHealth works.
Sure.
Here we go. Slim's walking in here, into the digital door or whatever we do. We shake hands, and what are you going to tell me? How are you going to educate me?
Yeah. So you walk in and you want to be a member of CrowdHealth. You'll pay $175 a month. It goes into an account. That account is yours. So we take $30 of it for a subscription fee. So $145 stays in that account. If somebody in the community has a health problem, let's say Andy breaks his arm and it's $5,000, Andy will pay the first $500. CrowdHealth will go to its thousands of members and say, hey, will you pitch in and help Andy with his broken arm? So you'll ask, let's just say 90 people for $50 each, right? That will get me enough money to pay for my broken arm. And they can say yes, or they can say no to giving it to me. It's a community where I'm not making it mandatory. If they say yes, then money goes from their account to my account. If they say no, I move on to the next person and I ask another person. And then eventually what I will have is enough money in my account to go and pay for that, broken arm. Or if it was an emergency room visit, you have your emergency room visit, they bill you later. We will then crowdfund it for you. So then you have enough to pay that bill. So it's really kind of bringing back this community feel to healthcare. It's the way that we've been doing in this country for hundreds of years, how people have been doing it around the world for thousands of years. It's like, look, if somebody in your community gets hurt or whatever, then we'll step up to help them, right? Mm-hmm. If they get hurt and they can't plow their fields, then people in the community come around them. It's like, okay, let's help them, plow their fields or do whatever. Unfortunately, the government and insurance companies have wedged themselves in between me and my community members, me and my neighbor. So I'm not really responsible for my neighbor anymore, right? Yeah. I'm not really responsible or need to help them because they got all these intermediaries in between. And it's like, man, that's really taken the community out of our country. And whether it's a neighborhood outside of Austin, Texas, or a neighborhood outside of, people who live in or outside of Corsicana, Texas, right? Like it applies across the country that we're losing this sense of community. And that's what I want to bring back to this country, is like that sense of community where we actually really cared about our neighbor, cared enough that we want to help you if something goes wrong.
Well, I've seen that. And whenever I was in big tech, I did a lot of research and analysis. And in 2004, I believe I was given a task, and it was a pretty long project, but it was about the division of interpersonal communication and what digital means. We're going to divide this, country, divide the family, divide everybody in that family. And they were studying it so they could actually accrue more money out of the individual instead of out of the family. Just like I think happened in the early 70s when you took the mom out of the home and put her to work, you had more taxpayers in the family. That's something I've witnessed personally in small town Texas. And by saying that, whenever you do have that division, and, as a child, I had a buddy, he wasn't really a friend. He was a little bit older than me, broke his neck playing football, at the high school stadium. Once again, the community got together, and for the rest of his life, there was a trust fund that was basically developed by the community. And for the rest of his life, he was okay. He led a good life as long as he could because of the injury that he had. Mm-hmm. If he wouldn't have had that local community, he would have been screwed. And what you're doing and what you're talking about, and actually what you're actually having very good success with, is something like that. It was a major injury. It destroyed a young 16, 17-year-old's, life that he thought it was going to, he was going to be able to live, but that community got behind it. Yeah. I think probably one question you probably hear a lot of is like, hey, what happens if, I'm in this plan, my wife has this major illness or my child has this major illness? How can CrowdHealth afford to be able to compete with the mass amounts of a Fiat type of billing system that you've witnessed, I've witnessed several times? What is CrowdHealth? How does it attack that? How does it give people, confidence?
Yeah, I mean, and this is the kind of the core of why we're able to get pricing that is so much better than health plans is we actually allow members to pay in cash for their services. So imagine you're a doctor and you have somebody who wants to pay you in cash versus you having to spend time and money billing a health insurance plan. It takes about 30 to 40% of their costs, of the revenue to bill, right? And so if I show up with a credit card and it's 1.5% or 2%, you're ripping out a massive amount of administrative costs for just billing the health insurance plan. In addition to that, the doctors typically spend about 30% of their time dealing with health insurance companies. That's 30% that they could be taking care of patients. And so we fix that billing problem by giving them a credit card, like, here's your credit card, bill it, right? And we give the doctors time back because they don't have to go and get a pre-authorization from a health plan to do a certain procedure. And so if we go in and say, we'll pay in cash, we're getting 30, 40, 50% discounts versus what health plans will pay. And so you as an individual can actually negotiate your bills more effectively. You have more power in negotiating your bills than United Healthcare, which is the 7th largest company on the planet by revenue. And that's one of the beauties of our model is we are bringing consumerism into healthcare, and that's getting us significantly better prices. And docs love us. Like, they're like, please, can you send more people our way? We'll give you huge discounts if you just pay in cash, so I don't have to deal with the health insurance plan. Right. And by the way, the day you provide the service, it takes about 60 to 90 days to actually get paid. Right. Yeah. So imagine that if you were working for a corporation, a lot of people, I'm assuming, who read this are right. Like, and you don't get paid. Oh, you're providing a service today, I'll pay you in 60 or 90 days. You'd be like, hell no, you're not. You're paying me now, latest within a week or two. Right. Like that's not even acceptable. So the doctors love us, and that's why we're able to get good pricing. And it helps even more with the big ones. So let's just say your wife or somebody has a NICU baby, right? Like a neonatal intensive care. It's $1 million. I can go into that hospital and CrowdHealth will negotiate on your behalf. And we're getting about 60 to 70% discounts on some of those big bills. Because look, that hospital has a decision to make. They can try to take all $1 million from you, put you into bankruptcy, or they can negotiate with you. And, 99 times out of 100, they will negotiate with you, and then you can get significant discounts versus what the health plans are paying just by acting as an individual as opposed to a part of a big corporation. And like I said, we're managing all that negotiation for us. We actually have attorneys on our side who are contacting these hospitals. And so, it has a pretty big impact.
And now we get a little story time, Texas Slim story time. Damn, do I like to tell stories. Well, I'm from Texas. Sometimes they're tall, sometimes they're not tall. Looking out this window right here, I see a bunch of cows. They're eating grass. They're not a carbon hazard. They're actually regrowing the soil. They're actually giving energy to this planet. They're giving energy to us, the individuals, in which we steward and in which we consume. We've been doing this for thousands upon thousands of years. But what I do see, I see fall in the air. It made me and reminded me of a time whenever I'd get tired of Austin, being from a small town, Texas, even when Austin was cooler than it is now, because it was. Y'all can fight me on that one. But one thing that I'd always do, I get a little tired of basically being in Austin. And I've always had my buddies and my cowboy friends and my mountain friends and my beach friends and everybody I could always go and kind of hang out with. So I've always been that hippie punk cowboy. But one thing I always did is in the fall, you guys that hunt know that it's the bulls are out there and they're screaming. They're bugling. What that means is it's elk hunting time. Well, I used to cowboy up in the Southern Rockies out there in New Mexico, and I had a buddy that I grew up with, and we'll call him Carrot Top. But anyways, Carrot Top, whenever I fled to Austin, he fled to basically the mountains. And whenever he first got to the mountains, he was he was a greenhorn. Not really. He grew up hunting all that, but he didn't know how to be a true mountain man. So they had horses up there and everything, but the fall was always fantastic. We always went on a fall hunt, and these were true hunts. They would go on for 2 weeks. We would pack into the San Diego de Cristo, sometimes a place called the Valle Vidal. But one thing we did was you get the horses ready. We'd break a couple of horses and whatnot. Me and old Carrot Top one day, we're out there, and he was young. And like I said, he was a greenhorn. He wasn't a horse whisperer yet. He is now, and I give him much credit for getting there. But what he did is he used to be a little rough around the edges whenever we get these cantankerous horses. We had mules, we had horses, and we would break those horses. We had one horse that we were breaking that year. We're trying to get it ready for a pack horse. And anyways, there's a lot of things we were doing with that horse. Anyways, I almost said his damn name. Carrot Top, he got on top of that horse, and he was in a bad mood that day. I think he was hungover. I'm not for sure. But what he did is he pushed that horse a little bit too long, and that horse went right up on him, and he kept on going back, if y'all can picture that. Oh, Carrot Top never let go. Time that horse landed on top of him, I think he snapped a few vertebrae that kind of hurt and gave him a cushion or two at the same time. Knocked the breath out of him, of course, and everything. Time the horse got off of him, I went over and checked him out, and his old eyes were just a squiggling, and he was having a rough time. Oh, Carrot Top was. Horse was doing fine, but Carrot Top was learning a life lesson. That life lesson is, whenever we're trying to make change in any type of spirit, you don't force it upon an animal. And that means horses, it means cattle, it means people. You don't force change. What you do is you basically steward change within people's spirits and their mindsets and their bodies. Carrot Top, he got busted up. We went to a small town hospital. They did some x-rays. He'd cracked a couple of vertebrae and stuff like that. He could walk. He was kind of dumb for a couple of days, but he learned a life lesson, and he's one of the best horsemen that I know now. He raised his boys to be some of the best horse stewards that I've ever seen. They're ropers. They're all that kind of good stuff that you fall into as young men, and your daddy's got a couple of horses that you get to play with, and you got some cattle that you can rope. So that was one of my experiences down there in Southern Rockies in New Mexico. It came into a time in my life where, I was all over the place. But what I was able to do is I was focused on how I was raised. And every time I got to go to those mountains and we got to get on those horses and we got to play with the cattle, we got to go hunt. We flew people in. They had a little money. And what we'd do, we'd pack in. And that year, Carrot Top had to do it with a couple of cracked vertebrae. We had a big storm came through. It kind of down trees. We'd always have to have a chainsaw. We had mules. We would pack in probably a week. It was a gradual process on an elk hunt way back in the Vidal. So it takes you a while to get back there. It takes you time to establish camp. And then you usually have about 4 guys that come in, and women, of course, and they get to fly in. And they get to be catered to. And we would fly in anything, their menu that they want. Sometimes it's about a week. Sometimes it's 10 days when these hunts would go, just because you're way back in the middle of paradise, basically on horseback and mule in the fall in the Southern Rockies. Well, long story short, we had a great hunt that year, but I just want y'all to remind you, carry your tools with you. Old Carrot Top went on a hunt. He was gone for 2 days with one guy. It was the last bull of the season that we were going to get. Everybody else stayed back in camp. They had, one guy got a cow. That's all he wanted. Other people got smaller bulls, but we're going for that trophy. Well, Carrot Top went out there, and they were 2 days back. They were solo on their own, 2 of them, and they got a good sized bull. And I believe he was like a 6'5". But one thing that Carrot Top forgot, because he got hit on the head, because he was trying to break a horse and he was trying to change the spirit in the wrong way. Well, guess what? He had forgot his damn knife. And all they had was in the middle of nowhere, out the middle of nowhere, in the middle of the Southern Rockies, in the middle of the Valle Vidal, the San de Cristo Mountains. All they had was a little pocket man knife. One of those little things that got little pliers on it, got a little screwdriver. Kind of a Swiss Army wannabe. I don't know what it is. A leather man. That's what it was. All Carrot Top had was a leather man. And he had to quarter an elk out the middle of nowhere, Valle Vidal, San de Cristo, Southern Rockies. So always remember, carry your tools with you. Always know that you can't change. You can force spirit upon somebody else. You got to steward it. You do it with respect, honesty, integrity. Always remember, there's always a story coming from Texas Slim. They're only going to get better. I'll follow up on that story a little bit later on. Love you guys. Peace. God bless. Much gratitude. Let's move forward with some integrity. Well, and I think that a lot of the general public doesn't understand how that is possible. A lot of times, if you've gone through a major incident and maybe insurance, we know how many calls, how much harassment happens to those who can't afford to pay their bills when it comes to healthcare in the medical and the insurance industries. They are very powerful. They can really destroy people's emotions, and they're basically, they can liquidate people's lives pretty easily. If you don't have this type of knowledge saying, hey, this is always a negotiation. It's a value for value. Mm-hmm. This is what we're going to do now from here on out, as far as the consumer. And like you said, the doctors probably think this is the best in sliced bread, right?
Yeah,
so they're like,
they love it.
Hell yeah, man, we'll do this. We'll treat every one of your patients. Please, we'll put them at top of the list because we want to be treating a patient differently, because most doctors, they have less than 15 minutes to talk to you anymore.
Right.
That's some statistics that are out there and I've heard it from the doctors themselves. And I have some doctors that have, really came into the VF initiative and provides me great information about, where we are as far as health in the United States. But also some of them are kind of wanting to check out. So here's another roadmap and another rabbit hole that they can go down and saying, well, maybe I've had a medical doctor say, screw you medical, industry. I'm going to be a functional medical doctor now.
Yeah.
I'm going to be more proactive instead of reactive with the way I am a doctor and how I treat my patients. And I think as we keep moving forward, in each conference that I've had somebody that represents, functional medicine and medical, but it really comes from this point of view of basically doing a value for value exchange from the patient to the doctor. And how do we get there? Something like CrowdHealth. And so, one thing I think people have a big question mark, and you've done it. You've done it personally, just like I've done everything I do in the Beef Initiative. I don't do anything unless I go out there and show proof of work. But how are we going to let people or give them the education or the guidance to position themselves to be able to get out of the insurance, racket that they're captured in at this point in time? And what is kind of the roadmap that you can kind of give some advice towards? Yeah,
I mean, I think, interestingly, some of the best marketing is actually coming from the insurance plans. They're the ones that are sending us like, these, they call them EOBs, these explanation of benefits. I'm sure, some of your audience has gotten these things. They're like pages long. They got CPT codes on them. And you're like, what the hell does this mean? Right. And the funny thing about this is like 80% of those are incorrect. Those are the statistics. 80% of the bills that you will get from a hospital are incorrect. And so, you send those, all you have to do is when you get a bill in the mail, which you and I live in Texas, so I think you can commiserate with me. Like the two things I hate getting in the mail are property taxes and healthcare bills, right? Because 100%. both of them, you're like, I don't have a freaking clue. Like it's a fiat system, right? It's like, I'm going to tell you what you're going to pay. And we're saying on the healthcare bill side is, no, that's not how much I'm going to pay. I'm actually going to negotiate with you. And there's actually a law. It's Universal Commercial Code 2-305 that says, if you do not provide a price up front, you have to negotiate a price later. You can't fiat it. You have to negotiate it. And so we have attorneys on our side that will negotiate for that for you. We'll look through your bill and make sure it's right. Again, 80% of the time it's wrong. So that's, right off the top, we go to the hospital and say, you billed us incorrectly. Who should we contact about this? And the regulatory authorities to tell them that you upbilled us for a charge that I didn't even see that doctor. So we help you with that stuff. So it's, man, I think the health insurance companies are like, the Kodaks and the Blockbusters of the day of, the 80s and the 90s, where it's like they're screwing up so much and they don't want to, do anything that's going to hurt their core business, that ultimately they're going to be disrupted. And I think it's going to be by people who are so pissed off that they have no say in what goes on with their own healthcare, that ultimately people say, I'm not doing this anymore. I'm out. I'm opting out of health insurance. And so we're just trying to get on as many, podcasts or blogs or things and just tell people, like, you can do this outside of health insurance. I got a wife and I have 2 girls. Like, I am 100% confident in my ability to pay my healthcare bills without having health insurance. Right. And I wouldn't do this. My family's on this. Like, my money is where my mouth is. Right. And so we're doing this. And, we had somebody who told us they had colon cancer last week, and my heart didn't even skip a beat. I'm like, all right, let's do this. This is what we're for. Right. So we just got to get out there and spread the word and sponsor more things like you're doing and find the people that this really resonates with. And I think, man, the ranchers and the folks in the beef initiative, either they're the buyers or the sellers of that, I think will really resonate with this, screw health insurance, opt out of the Fiat health insurance system and try something different.
Well, I think what's magical about all of this, it is word of mouth. That's what Beef Initiative has been from day one. We're not a marketing campaign. We're grassroots. You guys are grassroots in so many different ways as well. But what I feel like whenever I speak to you and the times that we've met is that, okay, well, hell yeah, I want that accountability. I want that obligation to steward my family, my health, my family, my children the correct way, because I know on the other side, CrowdHealth has found some doctors and finding more and more doctors that are going to have the same state of mind of obligation and accountability. And whenever you have 2 different parties, once again, there you get your value for value exchange. You get that intentionality of your health and how you live your life. It's like, okay, I'm obligated to help take care of this community that is with me, doing this with me, and I'm doing it with them. As far as this being a community-based healthcare program right now in our society, and it goes back to that vision of, interpersonal communication. You don't know your neighbor and everything like that. What it really does, it starts forming a state of mind that it is a sense of empowerment. It's not fear. It's a sense of empowerment in the industry that we have to operate in. Within the insurance industry, it's a multinational big O conglomerate that basically you do not feel secure. The only time you feel secure is if you don't go bankrupt. You're like, whew, man, I survived that one. What's next? What does that do with your emotional state of mind, with your financial state of mind, with your empowerment of your own self and your own spirit, your own family? There's so many things you can point at that what you guys are doing. It really does allow somebody to say, okay, there is a different option here.
Well, it's infuriating to me that, these health plans, about 1 out of every 5 claims they deny. They deny all these claims. And so you go in thinking that, oh, well, I'm taken care of and I should feel safe. And it was like, no. Like, these companies actually have a financial incentive to deny your claims, and that's the challenge. And so we had 250,000 families last year go bankrupt, even though they had health insurance due to a health event. Right. And so it's like, because their claim got denied, or they have this huge deductible, on their health plan where they don't have $6 or $8 or $10 or $12,000 to meet their deductible, and so they're going bankrupt as a result of this. And so it's like, man, like that's got to change. It breaks my heart, and we've got to do something now, or else the federal government is going to do something, and that's going to look like a Medicare for all, which now the government directly can tell you what you can and can't do with your health. And that's what I'm trying to combat. Is I don't want a federally mandated, health insurance program, because that's a disaster for everybody. It's been shown to be a disaster around the world from my perspective. And so we've got to get back to being community members. Just a couple of quick stories here about the community component of this, because I think it's so important to what we're doing. We had a member 2 or 3 months ago who got her hand caught in the prop of a boat. It severed 4 of her fingers. So the bills were $50,000 or $60,000 or something like that. And so we went out to our community members and said, "Hey, will you help this woman?" And we told the story, and they actually came back and said, "Not only am I going to give what you asked me to give, I want to give more. I want to give more to this woman because I feel so bad for her and what she's going through." Right. We had a miscarriage 3 or 4 weeks ago, and we went out and crowdfunded it. And people came back and was like, "I feel so bad for this woman in the miscarriage. Like, I want to give more to them and help them." Like, that's what community does. It's like, I want to help you so that you can get back to a place of where you need to be. And you'll never see that within the health insurance. It's not like you go to your doctor and the doctor says it's $150. You're like, "You know what? I want to give you more than $150. Like, it just doesn't happen. So I think that's the power of the community. And, we're all part of the same community. And so if we try to, suck out as much value as possible, then that's going to have a direct impact on other community members because they're paying in, right? They're helping you or not helping you. So there is this trying to bring back this community component of what we do. And we have a community of Bitcoiners too, who are sharing, funds just between each other, which is kind of cool. And so it's like, hey, I don't want you to spend too much on me. And so I want to take care of myself because you're going to have to go and sell your Bitcoin at some point, right? Like, I don't want you to sell your Bitcoin. Like, that's not what I want you to do. So it's these affinity groups that I think are really building community, and it's pretty cool. All I need now is like 1,000 ranchers to sign up, so I can have a rancher, community who are all sharing, bills with each other. They're, "Hey, I know what you're going through. I'm happy to help you out as my community member, of the rancher community."
Well, and before we hit record today, we were talking about, you just took a drive, right? Mm-hmm. And thank you for that, breakdown of, letting, because you're right. And to reflect on what you said, that's peer-to-peer, people, then once again, peer-to-peer relationships that humanity is strong right now, people. We don't have to live in this fear that they're pushing down everybody's throat every day. We have ways to actually get back to where you're yearning for and everything. And that's a perfect example, people helping people. And it's not cliche. This is actually happening. You get to see it, and your life is improved just because of what you're doing, because you're pointing your compass in a different direction, and you're basically showing proof of work, and you're building, you're innovating in a time of mass prohibition. And I tell everybody all the time, during these times of mass prohibition, and there's personal space, mind space, everything that they're doing with money, socially, everything, it's time to innovate in a massive way, just like they are. And so that's what you're doing. And here's a kind of a reflection on how much it's needed. You say the ranching community, which is rural community. Well, you just went on a drive in the state of Texas, and you were telling me about it. So let's talk about that, because I've mentioned it several times, and now you got to witness basically what I've been saying since I left to Tennessee back in late May.
Yeah, so I had a wedding up in Tyler, Texas. I live in Austin, so went up, up 35 and then headed east. But as you head east, you go through about 15 or so of these little rural Texas towns. Our favorite one, we were kind of joking about it in our car was called Karens, Texas. And we were just wondering how many Karens live in Karens, Texas. I'm sure Karens, Texas is great, but I'm just making goof. Mount Calm, Texas. So all these little towns where you roll through them. And as I mentioned to you, I was listening to you on Marty's podcast, a week and a half ago or so. And you were just saying, like, all these little towns have these Dollar Generals and then, some kind of fast food. And so what I noticed was, like, the first time you go into the town, there is Dollar General. It's like the first store. And then, a quarter mile down the way, which is like halfway through the town, right, is a Dairy Queen. They might have a Sonic in addition to that. But I can tell you what, every single one of those towns had a Dollar General and a Dairy Queen. Some of them had 2 Dairy Queens. And I'm like, holy crap, this is where people are getting their food. And knowing, and I've kind of been on the learning curve over the last probably decade or so around how what I put in my body actually impacts my weight, and have been transitioning to more of a carnivore-like diet. I'm like, there's no way I could live in this town and be able to eat the diet that I eat, in Austin, Texas. Like, I just can't do it. And so it's really sad. And then you go outside these towns and you have just all kinds of land, that's pretty much empty. Or, as we were talking about, has these like big windmill things, turbines sitting in the middle of them. And I'm like, holy crap, like what are we doing to our planet? I mean, this is absolutely absurd to me. And so those food deserts, as we think about them, the mainstream media wants you to think about, that's just urban core, right? Those are just the poor people of the urban core have food deserts. And I'm going through Karen's, Texas. I was like, this is a freaking food desert because they only have two options and both of them are crappy.
Yeah. And I try to get, these little one-liners that people can remember. And I always just tell everybody, I said, right next to that, you used to have the old gas station, and it had a vending machine in it. And that was it. Well, the gas station turned into the convenience store. The convenience store turned into the gas station. Well, now modern times, where we are, state of affairs right now, is your convenience store has now become the new supermarket. And the supermarket is the old convenience store in so many different ways. And that is the source. That is the market access to any type of food that those small communities want to have. What people really do not understand, and I can say this very strongly because it's where I come from, these small towns used to be the strongest and the most healthiest in our nation. And now they are some of the most unhealthiest, and they are captured within this basically the centralization of our food supply that's happened in the last 50 years. And we don't have to go down that. I said, talk about it all the time, how it's happened, why it's happened, and everything. It is real. And people need to understand that most of America right now, most of rural America is a food desert. And people don't want to admit this. They don't see it. They stay on the interstate. They take the easy way through and they circumvent around any of that stuff. Because you get on that interstate, you get on I-35, you're going to get your Best Westerns. You're going to get this restaurant, this restaurant, this restaurant. Go drive 25,000 miles across the country and you're going to see the same damn thing everywhere you go on the interstates. It is controlled, the food, everything. Go to a small town. It's all controlled by the same thing. It's Dollar Generals. It's a convenience store. And it's basically, like you said, a Dairy Queen in Texas, whatever you want to call it anywhere else. And you're right. Dairy Queen and Sonic have they've got a grip of the market access to fast food in these small rural towns. So let's look back at that. In that same rural community, you know what you got? You got an animal producer somewhere really close to you that has been shut off out of your life, out of your basically market access to even know who they are. And what they usually are is they're a rancher trying to basically live and trying to basically grow and steward the land and the food for you, the consumer, the community in which they live in. That's where we came from. That's how small town Texas was so powerful throughout, all the way up until now. Let's say in the 80s, in my small town got killed by the savings and loan and by the land acquisition that happened from farmers back then. I saw my small town die. It was a dead town whenever I pointed my compass towards Austin. Well, right now, people can really understand that there's plenty of land. We don't have to worry about the land. It's how we access the land. But there's also plenty of good, really dense nutritional protein for these families in these rural communities. I hear the ranchers all the time saying, I have to sell way over there because I can't get people to understand that I'm right here. And it's because of the centralized form of consumption models that we use with audio and video. The rancher doesn't have a voice anymore. He doesn't have a voice whenever he's stewarding his land and his cattle and his lifestyle. Well, he doesn't have a voice whenever he's in healthcare either. They've lost it. And one thing that people can understand, and that's what we're going to go for, especially you and I, is we're going to reach 1,000 ranchers. Let's meet 1,000 ranchers that hear this and say, okay, now I see what they're trying to accomplish. Let me look into this, because there's so many rural communities across this nation right now that are ready for it. We just have to get out there to them. We have to reach them. And it takes, especially the Bitcoiners, but anybody else out there listening to this, it takes us being able to spread this word, spread this message, and understand the problem, get the source of the seed of the problem, get to the source of the seed of the solution. If we can hit rural America in the way that I'm trying within the Beef Initiative, and we can do it for CrowdHealth as well, we're bringing pillars of strength back into these people's communities, into the individual sovereign mindset that a lot of these ranchers already have. They're already decentralized as much as they can be. And if they can have that pillar of strength of thought, this is what we're shooting for. This is my goal, bringing CrowdHealth in and partner up with you guys.
Yeah, well, I appreciate that, because we are all on board with that. I think, the ranchers out there can kind of listen to this and say, you can have access to the best healthcare in this country. It's like one of those things where we rip on our health system a lot, right? But if you have a heart attack, you want to be in the United States.
Yep.
If you have
100%.
cancer, you want to be in the United States. Like, there are hospitals in New York City that have full floors that just cater to royalty, foreign royalty. The Saudi family comes to New York to get their healthcare. Like, you can have access to that. And even if you're in, Cairns, Texas, because what we give you access to is like, look, jump on your phone or your laptop or whatever, and you can talk to a doc virtually. There's no need to walk into his doctor's office. Like, there is very little need to walk into a doctor's office. If you have an urgent care issue, talk to a doctor virtually over the CrowdHealth app. If you are, have some other kind of specialty issue, a heart issue, talk to a CrowdHealth doc over the app. You can talk to them, some of the leading clinicians in the country you can talk to over your CrowdHealth app. You don't need them in your backyard. And so we truly believe that we can give rural America access to the best in the world virtually. If you're comfortable with that. And I think more and more people are just becoming more comfortable with, like, I don't want to hang out in a clinic or a hospital ER or any of the things. Like, I want to be, here in the comfort of my own home, talking to a doctor who can help me think through this. And all of that stuff is included in your membership at CrowdHealth. And if something does big happen, then, you can get to the local hospital. But other than that, you really can care for yourself really, really well from the comfort of your home, as opposed to going and seeing a doc.
Well, you gave me a reflection on my childhood. I had Dr. Boswell. May she rest in peace. She was a hell of a doctor. She delivered me. She set my broken bones. She did so much. She finally gave up on me when I was about, 16, 17. I had broke my arm again that she had set when I was younger, and they had to put a bunch of metal in it. So she said, don't do that. So she was a little older. She was phasing out at that time. But you bring up, if you do get beat up, if you have a heart attack, if you get, I've broken my neck. I've got 20 broken bones. I got 14 pieces of metal. I've got several life and death stories that I'm going to start bringing out of, like, how did I get here? So by saying that, you're reminding me, I broke my damn toe once, and my dad, Dr. Boswell, lived 3 blocks away, and it was a form of, like, I felt okay. It's like, man, she's part of the family. And I believe that people can really start, in these small town Texas. So many doctors have left small communities. How many doctors would love to be in a little town of 1,500 people, and that's all they do is take care of people in that small town?
That'd be awesome. They
can do it, but they're not allowed to. And we're not divorcing the medical industry. Some of it needs to be divorced of what we just said. And I will never backtrack on that. But what we need to remember is that we do have the best healthcare if you can get market access to the right healthcare.
Right.
And divorcing the insurance companies is a roadmap to get there. Yeah. Just like within food, we have the best animal protein in the world. It's by far, especially in Texas, because I'm a Texan, I'm going to say that. But we also have some of the worst food in the world. So what do? Divorce yourself from the shitty food and get back to the source of the seed of what got us here. And that's pure animal protein. For me, it's beef. It can be, fowl, hog, blah, 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 all that kind of stuff. Same mindset with insurance, healthcare, medical. That's what you have to decompartmentalize, so you can compartmentalize what you're going to do in the direction you want to go. Yeah. And I think it's fascinating. I've been waiting for something like this forever, and I can't wait. When I slow down a little bit, I'm definitely I'm signing up. I haven't had time. I've been on the road.
Just don't add any more metal when you sign up.
I'm not going to, man. Hopefully those damn days are over with. I'm tired. I don't want it no more. And I'm feeling too damn good these days, so I don't want to break anymore. So the last thing I did was chopped off half of my finger. So I'm done. So
good.
But awesome. You know what? Whenever I went in there, they took care of it really fast. I've had excellent care whenever it comes to that mechanical type of putting me back together. It's been fascinating. But what I had to do to be able to, to overcome the bills, everything, when I had insurance, when I didn't have insurance, it is. It'll destroy you financially. It'll destroy a lot of people and destroys a lot of families every year. Like you said, 250,000 probably this last year went into bankruptcy because they got sick or they had an accident.
And I want to echo something you said, which is like, this is not anti-doc. This is pro-doc. It's like, we love the doctors. We have the best doctors on the planet. And it's like, we actually want to empower them to, be able to practice the medicine and not get into the administrative BS of the health insurance. We want to give them back the joy of practicing medicine, which is why they did it in the first place. So, a lot of people want to point their finger at the docs and say, oh, it's the docs. They're making too much money, all this kind of stuff. Well, the stat is that the doctor's salary, the ones who are actually providing your care, is only 8% of total healthcare costs. So 8% of our dollars, going in, 8 cents on the dollar is going to the doctor, right? Like, that's the challenge that we have with our healthcare. And most of it is administrative stuff that the doctors have to deal with. So this is not the doctors. In fact, it's the opposite of that. Doctors want to disrupt this as much as I do.
Well, and now you made me think of something. And a lot of people are against, especially the mainstream people out there. They're still, the normies, whatever you want to call them. They're anti-rancher. This climate change, just carbon the cow's a carbon hazard. And I've been noticing a lot of ranchers are suspect of people because they think everybody hates them right now. That's all they see all day long. And so what people need to understand whenever it comes to the beef initiative as well, this ain't the issues that we're facing within the beef initiative. It's not the ranchers, it's the multinational corporations that are doing this. And we need to gather around and get every rancher to understand that we're behind you and we're here. That's my mission, is to give that damn rancher a voice. Well, let's give the doctor a voice again by allowing them to treat you in a way that they feel that they need to be moving forward with you as their patient, them as the trusted doctor that took an oath.
Yeah.
And that way that makes them a better doctor, makes you a better patient.
Yeah. The reason why the doctors can only spend like 7 minutes with you on average is because the health insurance plan has reduced their rates so low that they have to get so many people in to pay for all the costs of billing health insurance. And so it's like, they could spend a half an hour or an hour with you if they had, the capability, the financial capability of doing that. And so, if you go into the doctor and you feel like the doctor's not giving you enough time, trust me, it's not because of the doctor. It's because of the insurance company putting restrictions on what they can and cannot do. And then also putting restrictions on them by, jacking up the cost of billing the health insurance plan, which costs about 20 or 30% of the revenue.
Yeah, it's amazing. I mean, you and I could probably talk for the next 8 hours on this one, and we're going to. I've got some dates that I'm going to, we're into fall. We're going to be getting into, winter. We're going into the holiday season. And, this will be something good for you and I to really kind of keep on following up. We're partnered up and everything. So one thing, a lot of people that aren't Bitcoiners, they're understanding what's the Bitcoin play here?
Sure.
What is it with CrowdHealth and Bitcoin and Beef Initiative and Bitcoin? And so I have no problem talking about it, but I always like to kind of, follow up with it after a period of time, introducing the idea first, the why, and then discuss the why. And then you and I down here in November, December, we'll come back and talk about the how and the what.
I'm coming to your event in November, so I'm
awesome.
Looking
I was
going to
ask you. I was going to make sure you're there.
Yeah, I'm going to be there. I got permission from my wife just the other day, so I'm going to be there.
Fantastic.
So, on the Bitcoin thing, the thing that typically happens is you're sending premiums into a health insurance plan, and then they're holding it in this big pool of fiat, right? So if in case something big happens, they have this capital in the background, and it's actually regulated. Like, they have to have this capital. Well, the problem with that is you have a big pool of fiat, which is melting as we speak, right? 8.5% last month, I think it was. And so the value of that pool is going down. And so they have to charge you more to keep the value of that pool up, right? And so in essence, what's happening in healthcare is you're having monetary supply inflationary issues, which is decreasing the value of that pool. You're also having a systemic healthcare issue, which we talked about a lot today, which is also increasing the price. And so both of these things are acting all at once. And so we're working on the price side by negotiating as individuals. We're working on the monetary inflation side by saying, hey, instead of you putting money in and just letting it sit there, why don't you put money in, a part of it, which is going to be converted to Bitcoin. So you actually have like a decentralized group of Bitcoin accounts as opposed to one centralized pool of fiat. And so, and by the way, if that Bitcoin goes up, so it's at 19,000, I think today. If it goes to 100,000, all of that appreciation is yours. If you put money into a health insurance plan, they will invest that money as well. And guess whose profit that goes to? Them. So we want to put the profit back into your pocket on that investment as opposed to the health plan's pocket. And it stabilizes the entire group too, because it's in Bitcoin as opposed to fiat dollars, which are declining in value.
I love it. I love it. And that's a good kind of an introduction on how, this is going to really, I love it that we're early. This is fun. We are early into this innovation, and and people can have some faith because we have some proof of work. I mean, this is playing out. A lot of times people, it's not that they're anti something new, anti-idea, anti-anything. It's just, there's a lack of understanding.
Yeah.
And, every rancher that I talk to, they're an educator above anything, and they love to educate. You're definitely educating people within the health industry. And if somebody's watched this last, 45 minutes to an hour that we're on this, more education in this small period of time than most people have had in their lifetime when it comes to insurance companies, when it comes to medical. And what they can do is they can have faith that they can point their compass towards who you are, the company that you are. We're going to affiliate within our platform. It'll have CrowdHealth there. We're going to start incorporating all of our affiliations, all of our partnerships. And so people listening to this saying, yeah, I want more. Let's go into, how are they going to find you? Give people kind of a protocol of a roadmap of what they can expect from, removing themselves to educating themselves a little bit more today or tomorrow, this weekend, whatever it's going to be, to where they can, you basically are stewarding their change.
Yeah. Go and visit us at Join CrowdHealth. The first thing you'll do upon signing up is you're going to have a 15-minute kind of intro to what we do. And you have a care advocate, an ally in CrowdHealth. So we don't act like a big corporation where you call into a call center and you talk to a different person every single time about what's going on with your healthcare to figure out what the problem is. Like, you can call into CrowdHealth. You have the same person every single time. They'll walk you through how exactly it works. A lot of it you've heard today, and you'll be paying $175 a month into an account. And like I said, the money is yours. And so if you were to leave CrowdHealth, you actually take that money with you. This is not a, send it in and never see it again. It's your money. You're the agent for your own body, your own health. And that's just an exciting part of what we're doing. So go to joincrowdhealth.com. I'm on Twitter. If you want to see proof of work, Join CrowdHealth on Twitter. We actually are putting out the data that we are collecting internally. So, we had a guy in Wisconsin who had an $86,000 quote on his surgery. We found him somebody to do it for $22,000.
Wow.
We had somebody who, had an ACL tear. They had a quote of $22,000. We found it for them for $12,000. Both outcomes were stellar. I mean, we're showing our proof of work on Twitter. You can say, like, this is what we're actually doing on a day-to-day basis. So Twitter is probably the best place to find us. If you're on Instagram or some of the other social media networks, we're there too. But we'd really love people to give us a try, because we think it's way different. It's way better. You're going to get way better care, and our folks love it. So come give it a shot. Join CrowdHealth.com. I love it,
man. This is a great introduction. I think this is like I say, man, this is an international lifestyle. Everybody's going to come along with this. They just don't understand it yet, but we're getting there every time, every conversation we have, every meeting we have. We're going and we're engineering something that's new for a lot of people, that's going to give them a pillar of strength, within their physicality, within their sovereign mindset, everything about it, especially within their family and their community. So, Andy, I'm going to hit the road again. I'll be down there off and on for the next 10 days. I got to fly out to Charlotte too, but I'll ping you whenever I get down to Austin, and we'll go have lunch or something like that.
I'd love to do that, man. Thanks so much for the time, Slim.
Hey, man, I appreciate you. I look forward to this partnership, the change that we're about to unleash on the United States, at least, and the world. And even if it's just an understanding of where we are and where we're going to go. So,
let's do it.
everybody else out there, thank you for participating, and let's all do this together. This is community based. This is something that you don't have to ask for permission.
Mm-hmm.
Appreciate you, Andy. Take care.
God bless y'all.
Hey guys, I hope y'all enjoyed that recording with Andy and CrowdHealth. I see a lot of possibilities right there, especially in rural America. Everybody that we're targeting, especially ranching families, people living out in the country. But it doesn't have to be anybody. It can be anybody living right in the middle of the city. So, pay attention. Come to the Beef Initiative. Go to the Substack. Of course, you can get more information on CrowdHealth. This is something that we've been moving towards. I feel like value for value exchange is starting to, a lot of people are starting to talk about it. Adam Curry pretty much introduced it into my purview of understanding, and I see that it's most valuable within the Beef Initiative. Beef Initiative is value for exchange. We are grassroots. I started this with nothing more than an idea, wrote down a hashtag food intelligence, and I wrote an article called The Harvest of Deception. You're going to find out more about me, my story moving forward. We're going to get very transparent. You guys have heard me say that. One thing that you guys really need to kind of understand, we're supported by you, the listener. This is, we are not a venture capital funded organization. We are a set of volunteers that basically want to change the world, change your families, change the community. And how we change the world is we change the individual. The sovereign individual is what we're about. It's what I'm about, but we need your help. We need you to share all of this. We are not a marketing campaign. We're not mainstream media. We're not anything you see on the TV. We actually ask each one of you to go to work and to basically get us some assistance. If you guys can give us your time, talent, and treasure, we want to know what that is. Go to basically, you can go to our platform. You can go to the Substack. There's information. You can contact Sean. We have an email address for you. If you can give your time, talent, and treasure. If you can't, please share this with your family. Share it with your friends. Share it around the world. This is a global initiative. It's turned out something that started out in small town Texas is now going global, and we're going to make sure that we all are participating in this, whichever way we can. This is something that we're not going to walk away from. It's not something that is going to slow down. We've got a lot of momentum, and the momentum is you. And anytime you want to give us some feedback, give us some feedback. All the content information is right there on that Substack. And do remember, we are on the Fountain app. We are podcasting 2.0 thanks to Adam Curry and his team. We're a decentralized marketing or non-marketing, show, whatever you want to call it. We're a production. We're an orchestration. We are a facilitation. So, stack sats, stream sats, boost, that's it. That is the value for value exchange. You can also go to the Beef Initiative platform. We have a donations page. We have a formal scholarship foundation trust fund. We're going to be in partner with Unchained Capital. This is something that you're going to start hearing more of. We got a full Bitcoin that me, poor boy from West Texas, I was able to achieve over a couple of years, and I put it up for the Scholarship Endowment Trust Fund. I'm not a rich man. This is something that is my life goal. It's a life mission right now, and I hope you guys come along with me. Once again, 100,000 people on that Substack is going to help us save 100,000 lives. This is for the children of the future. It's up to us, the individuals, to understand what food intelligence is, what we're up against, what market access is, and basically, how we get there is each individual sharing their time, talent, and treasure. Much love. We'll talk to you guys soon.